out in case there's something you wanted to revisit. If you have questions throughout the presentation, you can put them in the chat. But like I said, with 38 people, it's also possible I can just have you folks ask the questions. I wasn't sure how many folks to expect. I didn't want to open the mics for 95 people all at once. So that's the quick housekeeping things. I'll move in. This is our agenda for today's presentation so that you know what we're going to be talking about today. We're going to talk about who the Mna is, a quick overview, and what makes us stand out as an organization representing nurses and healthcare professionals. We will talk about what is a day of advocacy. What exactly have you all signed up for? We'll go over the schedule for the day and why your participation is so incredibly important. We will talk about your story and the importance of talking about the view from the front lines. We will talk about the policy priorities for May 8th. Those are the legislation that we'll be advocating for and the public policy we'll be speaking about. Again, we're there to help you prepare for this, and we'll talk more about that in that slide. We'll talk about meeting with your legislators. What's it going to be like? What's going to happen on this day and how that's going to go. And then we'll talk about things you can do in advance of May 8th to prepare for the day. So jumping into our first item on the agenda about the Mna. I hope a lot of you are familiar with the organization. The Massachusetts Nurses Association is the largest organization of licensed health professionals in Massachusetts. We are the third largest nurses union in the nation, and we represent over 25,000 frontline providers across the state. We represent folks in small community hospitals, big tertiary hospitals, public health systems, school nurses, the state healthcare system and some of our state public health offices. It's a varied group of folks, but the one thing you guys pretty much all have in common is you are frontline providers. You are interacting with patients, you are interacting with the public. And that gives you a very unique perspective on healthcare. In contrast, there are a few other nursing organizations in the state that have a very different perspective. And we like to make sure that when we meet with folks, they know that the nurses they're meeting with from the Mna and the healthcare professionals they're meeting with are the ones who provide the direct care. So a contrast would be the Organization of Nurse Leaders is a group of nurse managers and CEOs who are nurses. And obviously, I think I can see some kind of shaking heads, like you can imagine that their perspective on bedside care and their perspective on the provision of healthcare in Massachusetts is probably going to be different than the one that you and your colleagues have from the frontline perspective. So we want to always be framing things. I'll tell a legislator, you're in an Mna hospital represented by us, you hit that call button. The nurse who comes to your bed is an Mna member. Like, that's who that is. They're not the person in the office. They're not the person who hasn't touched a patient in a decade or two. And that's a really important perspective we want to make sure the legislators know about. So what is a day of advocacy? Let's move first into our schedule for the day. So on May 8th, as you know, we are hosting from the Bedside to Beacon Hill, the Massachusetts Nurses Association's Day of Advocacy. We are going to gather at the Grand Staircase at the Massachusetts State House. It is an absolutely gorgeous setting, and I encourage people to bring your cameras. It's going to be a great day. Arrival at the State House. We are asking folks to arrive between 9:30 and 9:45. Traffic can be terrible. We'll talk about transportation a little while later. So we're asking folks to get there early. There are two entrances to the State House. There is one in the front, the General Hooker entrance. There's one on the side, the Ashburton entrance. You will be directed to one of those two entrances. We never know if we're the only group that's going to be at the State House that day, or if there are like 4 field trip buses coming in from the North Shore that day. So we want to make sure you have enough time to get through security. So though registration doesn't start till 10 and our speaking program at 10:30, we are asking folks to arrive by 9:30 or 9:45 to get through security. If you get through early, there's a coffee shop on the 4th floor. You can also wander around the building. It is absolutely beautiful. At 10 o'clock, registration. All of you are registered, so you will come and you'll check in at the registration table with Mna staff. You will be handed a packet for your day. It will have a lot of information. It'll have a map of the State House. It'll have this agenda. It'll have some materials for you around lobbying. It'll have some materials for you to leave with legislators. Most importantly, it will have a personalized schedule for you about the meetings we have made for you with your elected officials. So once you signed up behind the scenes, my team, a bunch of us at the Mna legislation division, have been making meetings based on where you live and where you work with elected officials who represent you. So when you get there that day, you will be presented with a personalized schedule. So that's part of registration. At 10:30, we begin our speaking program. We will hear from Mna President Katie Murphy. We will hear from a few nurses from around the state talking a little bit about the public policy issues we are going to be speaking about. And then we have our guest speaker, Christine Lilly, who is the third most decorated women's soccer player in the United States. So I encourage folks, if you especially have daughters or granddaughters who play soccer, please feel free to bring them with you to the State House that day, because it's a pretty exciting person to meet. Not only is Christine a decorated soccer champion and a resident of Massachusetts, she was also instrumental in the organization of the soccer union, the women's soccer union, and fighting for equal pay. I'm not sure if folks remember, a few years back, there was a huge disparity in pay between the U.S. men's and U.S. women's soccer team. She was part of the effort to kind of balance that out and equalize it. So she'll be talking to us about something that the Mna knows well, which is, collective action brings about change. When we fight, we win. So we're very excited to have her speak to us. Once she is done, we're going to organize a photo on the grand staircase. You will all be sent after the event a copy of the photo via the email that you registered with. Get a really nice photo of everybody. And then we're off to our legislative meetings. As I mentioned, you'll each get a copy of a schedule for the day. Some of you might have meetings starting at 11:30, some might 11:45, some might 12 o'clock. So meetings are running from those 2 hours. Your schedule will dictate exactly where you should go and when. At the same time, lunches will be available, so at 11:30. So let's say you've got a meeting at 12 and 1 and 1:20. You're probably going to want to eat your lunch early, or you can grab it to go on the bus, but that will be ready. And there will be Mna staff available during this entire time. A whole bunch of us will be there. A lot of us will be in blue. We'll be wearing things that help you identify who we are, and we're there to help you. You'll go to your meetings. We'll talk more about that later. And if you've gotten yourself to the State House, when your meetings are done, you've grabbed your lunch, you're free to go. You're free to hang out in Boston, walk around the State House, get yourself an official tour. I can show you where that is. For folks who are taking buses, who have signed up to take the Mna buses, those buses are going to be on the road by 2 o'clock. So once your meeting is over, if you haven't grabbed your lunch yet, we're going to grab our lunches. We have our bus captains, and we're going to move folks on to, get out and hopefully beat some traffic. As we've said to folks, though, if you're taking a bus, we can't guarantee a time you get home. So just kind of remembering that, it's Boston traffic. It took me 2 hours to get to Worcester from the South Shore this morning. So moving on. So we go to, what exactly is a day of advocacy? What have we asked you all to come to do? So advocacy days are events that allow individuals and groups to lobby legislators and their staff directly. This is the most important part. We are bringing you to Beacon Hill to share your own experiences at the bedside and in your practice with elected officials. This allows you to showcase your collective concerns and the power of a group of concerned citizens. So as we talked about collective action, the visual of nearly 300 of you in that building fanning out and talking about the things that matter most to you is so incredibly impactful. These advocacy days are going to help link your experience as a frontline caregiver with public policy. I go out and talk, some of you may have heard me, around the state to nurses and nursing students and graduate students and healthcare organizations, talking about how much public policy decided on Beacon Hill affects your practice. A few things. Did you know that the House of Representatives in Massachusetts this year passed legislation allowing unlicensed personnel to give meds in a nursing home? I just saw a couple faces being made. That's very concerning to us. Legislators need to hear from folks about that. Workplace violence prevention legislation. You or someone you work with has probably experienced violence at some point in their careers. Linking what's happening at the bedside with the best way to attack public policy is really important. And you being there that day is going to make those connections real for legislators. And hopefully it also makes it real for you, that the things you do can inform what happens in terms of public policy. Advocacy days are also great to connect you with your elected officials. If you do not know your state rep or state senator, this is a great chance to get to know them and their staff. because you can be an expert. You can be a resource to them. You can reach out when you see things, and making those connections is so incredibly important. And we want to try to make sure we maintain those connections beyond Advocacy Day into the future. So we touched on this a little bit. Why is my participation important? Why is your participation important? Because, as I said, the State House is where decisions are made that impact your nursing practice. They impact your patients. Examples: the ICU law that passed, a good but flawed mandatory overtime law that passed that we're still working on getting like fine-tuned. You are on the front lines of healthcare delivery, and your stories are so incredibly important. As I always let folks know, there are 200 legislators in the Massachusetts legislature. 2 are nurses. One is an advanced practice psych nurse, and one is a former Brigham ICU nurse and former MNA president. That means 198 people in that building do not understand what you do and what your patients go through. So your story is really important to them. You are the experts. If anyone here has ever testified for me at a hearing before, I always remind you, you go into a room, you'll see a lot of legislators, there's wood paneling, it maybe feels all official. I remind you, you're the experts. You know patient care better than anyone else in that room. They have not done central lines. They do not know, how to look at someone and assess, whether the medication they're taking has been effective, or if you're concerned about their well-being at that moment. You are the experts on your practice and your patients. And the thing I always remind folks, if you are not telling legislators what's happening at the bedside, who is? As we talked before, there are other organizations of nurses that might have a different perspective than you do. There are hospital association representatives and lobbyists who probably have a very different perspective on the healthcare delivery system than you do. There are insurance companies, there are pharmaceutical companies. There are a lot of folks who have voices in healthcare, and we want to make sure that your story and your experience are part of that narrative on Beacon Hill. This is one of my favorite slides. What influences legislators the most? Constituents. That's you. That's a fancy way of saying people who live and vote in districts. I can't tell if the circle thing is showing up or not, but basically what that's trying to indicate is the #1 influencer. I have a chart there, and I can't see it, but I can't tell if you all can. The #1 influencer on legislators are in-person visits from their own constituents, the people who live, work, and vote in their districts. You have the most impact when you take the time. They know it's not easy to schlep all the way into Boston. They know, especially if you're coming from farther out geographic areas. I think our Western Mass legislators appreciate it the most. But they know that if you're showing up, you're taking the time to tell them what's going on, they're going to listen to you. And you have a very, very influential role in public policy in just showing up and talking to your legislators about what's happening. So that's what Advocacy Day is and what we're trying to accomplish. So one of the things we want to make sure that that folks are able to convey and that legislators take away from this day is the view from the front lines. Again, we are the folks delivering the care. A lot of you were on the front lines of COVID. You've been on the front lines of our healthcare delivery system, some of you for decades, some of you for a couple of years, and you have perspectives that are incredibly important to legislators. You're at the bedside in the community. You provide 90% of the clinical care patients receive in this state. Obviously, other folks provide care too. But when a person is admitted to a hospital and they are kept there, they are there because they need 24/7 nursing care. You all know how fast we're now turning folks out. Day surgeries have gone up. We're discharging people as fast as we can. So if you are in a hospital, you need the nursing care. And that's so incredibly important to convey to legislators, because we're seeing the healthcare landscape shift, and it's concerning as to how they're viewing the care that's provided to patients in our healthcare facilities. So the things we hear from nurses and the things we hear from frontline healthcare providers and healthcare professionals that we want to make sure we convey to legislators. We hear it from you. You're stretched too thin. You're being forced to care for too many patients at one time. It's taking a toll on your patients, and it's taking a toll on you. Just quickly, show of hands, how many folks here know of a colleague or someone who has left the profession or left the bedside because they've burnt out? It's too much and they can't do it anymore. I see hands. I see a lot of hands. We want to convey this to legislators, that they are losing experienced nurses, they are losing new nurses, they are losing experienced healthcare professionals, they are losing new healthcare professionals. Folks are burning out and leaving the bedside. You've probably heard a lot about staffing crises in healthcare, workforce crises. We want to emphasize that folks want to do these jobs. You want to do them, but you can't under the current conditions. And to remind legislators, we cannot recruit our way out of a retention crisis. The situation at the bedside is not good, and that is why folks are leaving. We have heard from survey after survey of Massachusetts healthcare providers, nurses, healthcare professionals, that care has deteriorated in their facility. I think we've gotten to a point this year where it's something like 5 out of 10 frontline nurses would not admit their own family to their facility. And we need to be able to convey that to legislators, but explain why. Like, why is care deteriorating? Why are you worried? Why are things not going the way you think they should at your facility? We want to explain using examples where we can, obviously respecting HIPAA, de-identifying, but let them know. Did you work in the ED last night and have 8 patients? Were you concerned for the outcomes for these patients because of that? Did you drive home wondering, like, I had 7 patients, or last night, did everyone get what they needed? I'm concerned for what's going on in our EDs. I'm concerned in our psych wards. I'm concerned because the maternity ward I used to work in has closed. And now I know patients get to me and they haven't had prenatal care the way they did when they had a close maternity hospital open near them. So it's those examples that really stick with legislators. So one of the things I just mentioned and that we want to talk about is the difference between a staffing a staffing crisis and a staffing shortage. They are 2 different things. We are in a staffing crisis right now because nurses and healthcare professionals are leaving the bedside, they're leaving the front lines, they're leaving the profession. At the same time, we have enough nurses, especially nurses. We have more RNs per capita than almost every other state in the country. We have added 45,000 nurses since 2019. That is a 38% increase in nurses. Folks want to be nurses, and we graduate over 3,000 nurses each year. We have a strong pipeline. The problem is keeping these nurses in the profession and at the bedside, and that's sort of the needle we're trying to thread with legislators. There's a crisis, but it's not a numbers crisis. It's a retention crisis. It's a staffing conditions crisis. There is, and I've told legislators this many times, there is no magic pool of nurses coming to save us. We need to save ourselves, and we need to make sure they're listening to you about the things that will keep you and your colleagues at the bedside now, 5 years from now, and for the younger nurses, 20 and 30 years from now. What makes them see a long-term career when 50% of them are leaving the bedside within the first 5 years? And Marianne sent me a note. I'm going to take questions at the end, I think was my plan, because I see someone's hand up. I don't mean to ignore you. I just want to make sure I get through everything. And I promise we will go back over any questions anyone has. Okay, continuing in the vein of we have enough nurses. Crisis means opportunity. That can be a good thing for us, an opportunity to educate on the conditions at the bedside that we need changed, better staffing, less violence, more safety programs, and access to essential services for our patients. On the flip side, it is also an opportunity for others to try to get public policy passed that is not good for nurses and not good for patients. For example, I'll talk about this in a little while. We don't have enough nurses, cried the hospitals. We can't possibly get through this if we don't outsource nursing to other states. Folks are familiar, you've heard of hospital at home, you've heard of remote monitoring, perhaps remote discharge. This is the intention of this industry, is to farm out frontline patient care. And I think 20 years ago, you would have said you can't outsource a nurse. Well, now we're seeing nurses monitor remotely ICUs. We've seen nurses asked to do discharge remotely from hospitals, not even seeing the patient or touching them. And if we make certain public policy changes, not only will those be remote within our state, they will be remote from out of state. There is something called the Nurse Licensure Compact I'll talk about in a while, but that would allow 40 states worth of nurses to overnight automatically be licensed to practice in Massachusetts. That means hospitals would be able to have remote monitoring in Indiana, of say, the MGH ICU. And that is not a solution we want to see to the current crisis. We want to make sure that we're educating folks on keeping care at the bedside and doing it responsibly, and not outsourcing nursing care in a way that they see as being cost effective, but we see as being a deterioration of patient care. This slide just sort of backs up what I had talked about. An independent analysis by our state's Health Policy Commission last year found that the current nursing shortage reflects increasingly difficult work environment and not a lack of nurses. So again, it's the environment. It's not that we don't have the nurses, and we need to make sure we keep them there. So let's talk about our policy priorities for May 8th. I'll open this by saying the MNA files 24 pieces of legislation every session. We also work on a myriad of other public policy priorities. It is very hard to narrow them down because each of them is important to someone. There's a reason we file them, and each one is important to a constituency or a group. At this point in the legislative session, though, legislators have decided what the issues they've let us know what they're going to work on this year. So when we selected our policy priorities to talk about, we narrowed it down to the priorities of MNA members as identified every year by our board of directors, and we go out and meet with nurses and healthcare professionals around the state, but also in what the legislature seems to have an appetite to address this year. So believe it or not, we narrowed it down to 3 areas, and with legislation in each, and I'll go into that now. But I wanted to let you know how we arrived at the policy priorities. So if you're saying, well, where is this or where is that? This was arrived at after much discussion around top priorities of Mass Nurse Association members and what the legislature looks to have an appetite to do with what's left of this session. So we put it into 3 buckets of policy priorities for May 8th. Protecting frontline workers with workplace violence prevention legislation and safe patient handling legislation. Protecting healthcare access, making it harder for hospitals to close units and take away essential health services in our communities. And protecting patient safety, which means limiting the number of patients a nurse can care for at one time and opposing attempts to outsource bedside care, as I had talked about just now. The next couple slides, I'm going to go through each of these issues individually. I do want to start by saying you do not need to memorize what is on these next few slides. The important thing you are bringing to these discussions is your own experience with violence in the workplace, or your own experience with the closure of facilities near you and how it's impacted your patients, or your own experience with having too many patients at one time, or your own concern about the outsourcing of nursing care. It is our job at the MNA to frame that in a policy perspective. So think of the next few slides kind of as background, just for information. None of you are expected to be experts on the public policy. You are experts on being nurses. So I just want to couch that before I jump into the next couple slides. I don't want to scare anybody. So workplace violence in healthcare. Probably does not surprise you to know that every 38 minutes in a Massachusetts healthcare facility, someone, most likely a clinician or other employee, is physically assaulted, verbally abused, or threatened. And that is data for the Massachusetts Hospital Association that is public. In 2021, we know that MGH reported in its own internal data, 2 to 3 nurses at their facility were assaulted on a daily basis at MGH in Boston. And we know from the Joint Commission that we have seen a steady increase in rates of crime, including violent crimes such as assault, rape, and homicide. Quick show of hands, who has seen violence in their own healthcare settings where you work? Have you experienced it? Have you seen it? Have you known folks that talk to you? Again, I'm seeing a lot of hands up. What we want you to convey is this is a real problem solution. That's kind of your role in talking about it. So on the next slide, again, do not feel the need to memorize any of this, but I'm going to kind of go over what the MNA has proposed policy-wise to do to mitigate workplace violence. We have filed legislation we worked on for about a decade requiring annual risk assessments at each hospital. We do this because we know the needs of, say, Cooley Dickinson Hospital are different from the needs of Boston Medical Center, are different from the needs of Neshoba Valley Medical Center, are different from the needs of Cape Cod Hospital. One size does not fit all when it comes to an assessment on the vulnerabilities for violence. We are asking for a comprehensive facility-specific, again, that's very important, workplace violence prevention program required, written and updated annually. We also want to make sure that you get paid leave to pursue legal actions following an assault. No healthcare employee should be required to take unpaid time or your own vacation or PTO to address the legal issues accompanying an assault while you are working. Full stop. So that's something else we've got in there. And we also want to make sure that we are reporting semi-annually assaults on healthcare employees because we don't have great data on it. And we want to see, kind of where we are. In the last couple of years, the Hospital Association has come out with a few things. Part of me thinks if they're putting out that every 38 minutes someone's assaulted, it's probably worse than that. So we want to make sure that, we're getting that information. And that's where our legislation comes in. Again, you do not need to be experts on this, just giving you some background. This is my job and my team's job to know what's in our legislation. I mentioned safe patient handling and workplace injury. Something that probably doesn't surprise you, healthcare workers suffer the highest rates of on-the-job injury of pretty much any profession. These direct and indirect costs add up to $20 billion annually. That is a lot of money. There is no safe way to manually lift a patient. I know some of you have been nurses for decades. You'll say, I learned to lift. The studies have shown over the years, there is really no safe way to lift a patient. You have equipment, we have ergonomically correct beds and positions. We have not caught up with that. 11 other states have passed laws around safe patient handling, and the VA about a decade ago redid all of their facilities to be safe patient handling and mobility compliant. We also know that for the patient's benefit, early patient mobility is crucial to recovery. So we want to make sure that we have, so for us, we have a safe patient handling and mobility legislation requiring that facilities adopt safe patient handling and mobility programs. We have in-house committees that are making recommendations regarding equipment and protocols, and the facilities are required to acquire the equipment deemed necessary by these committees. This legislation has also been around for about a decade. It has been advancing. We've gotten through 2 favorable recommendations out of committee. So we want to see if we can get this across the finish line this year. The next issue is essential services and the loss of those. Folks may be familiar, access is a huge issue in Massachusetts. Since 2009, we have lost 40 essential healthcare units, some of them full-scale hospitals, across our state. And that has left pockets without adequate behavioral health care for teens and adolescents and children. It's left some areas without adequate maternity care, for mothers, without pediatric care, for kids. One of the examples I give is in 2022, Tufts Medical Center decided to close their Tufts Floating Hospital for Children, which had existed for over 100 years. They said, we don't need the beds anymore. We don't, not at all, considering we just come off a pandemic where parents weren't taking their kids to the hospital on a regular basis. We're going to shut it down. We don't need them. People may remember the Globe 3 months later, headlines screaming, not enough pediatric beds in Massachusetts, kids being sent out of state, kids being sent to New Hampshire, Delaware. We don't have the beds. We don't have the beds. Because we're closing the beds. And we're not thinking any farther ahead than the next step. So it's you, again, are the folks who see this up close. If you've worked in a unit that's closed, or if you're a hospital that's absorbing closed units, because when a maternity unit closes or a pediatric unit closes, kids don't stop being sick. Babies don't stop being born. They just end up in another hospital that's overflowing. I know the Globe ran an article recently about, I live near South Shore Hospital. I think they have 360 or so beds, and their daily census has been almost 500 because Norwood Hospital has been closed since the fire. There have been other units that have been closed, so they're overflowing. So even if you don't work in a hospital that has a unit that's closed, and there are very few hospitals at this point that have that designation, you are probably handling the overflow, and it's affecting your patients in your practice. So we have filed legislation around that, extending our notice period, requiring additional community involvement, prohibiting closures during public health emergencies. During the COVID emergency, we had 2 ICUs temporarily closed. We had the only psych beds west of Worcester for teens and children closed during one of the biggest mental health crises for children and adolescents that we've ever seen. This would stop that. It would also penalize institutions that close essential healthcare services. What we see is hospitals closing what they call loss leaders. You're not making bank on maternity or pediatric services, but there is a social contract that hospitals have, a lot of them being nonprofits, that they're going to keep those services open. What they're doing though is closing them and opening money-making cardiac cath labs and rehab, like things that make a whole lot more money in terms of reimbursement. And this would say, you know what, you closed an essential health service that the DPH told you was necessary. You don't get to open that cardiac cath lab for several years. You don't get to get this immediate return on your investment. So it's hopefully sort of a carrot and stick thing. Again, this is more for your edification. There'll be talking points. We'll have this in writing for you guys, but any questions on policy, you're the expert on being a nurse, healthcare professional. We're the experts on the public policy. You can direct them to us. And the last big piece that we're going to address legislatively is something we are opposed to, which is the Nurse Licensure Compact. Folks may have heard of this. This would allow nurses licensed in compact states to automatically be licensed in other compact states. So there are, I think, 41 compact states at this point. Can you imagine having to know 41 nurse practice acts and what is allowed overnight? Can you imagine having to practice, next to someone who's been in 4 different states? I mean, I know some folks have worked with travelers, and this is not to malign travelers. They're a godsend sometimes, but it's not the way to staff up the nursing workforce. It's not going to fix the conditions at the bedside. And hospital administrators would have legislators believe if we just flip this switch, all these nurses would flood into Massachusetts. We'd have no staffing crisis. These nurses are not coming permanently. No one is uprooting their family for a move across the country only because we passed a licensure compact. This is going to bring in more travelers. And the hospitals are going to try to balance their scheduling on the backs of these travelers, which, as you know, means on your backs, because travelers get to make their own schedules. They're usually making more money. This would just open the floodgates for that. And for them to not deal with the issues at the bedside. If they can just, bring Megan in from Maryland, have her work, burn her out, rather than having to look and think, wow, we want Megan to stay in the profession for 20 years. Let's educate her. Let's make sure she's, happy, moving along, wants to stay here. Yeah, just burn her out. Now we'll bring Janine in. And now we're going to bring Marianne in. And now we're going to burn them out at the bedside and we'll turn them right out. And there's another warm body coming. That is not the way to approach nursing care. And it's not the way we want to frame what you do. Also, another important note, we talked about the outsourcing. They said the quiet part out loud. They're looking to do remote health. And they're looking to do it from states where they can pay nurses a lot less. And these nurses don't have the same qualifications as you. We also know that over 7,600 fake nursing diplomas were issued at a compact state nursing school. These folks then were able to practice in 41 states around the country. Massachusetts wasn't one of them because we're not part of compact. So, so something we don't want, because hospitals are up on Beacon Hill screaming, we have a shortage, let us just bring in these temporary workers, we need more of them. Research has shown states have had compacts since 1999. Texas was the first one. It hasn't increased their nursing at all. They still have a huge nursing shortage there, an actual nursing shortage, a lot of them. Our vacancy rate is lower than compact states. It's not a solution. All it does is allow hospitals to ignore the real issues that are driving nurses from the bedside, and conditions will just continue to deteriorate. So now that I've cheered everybody up with that last one, we'll move on to meeting with your legislators and what that's going to look like. So we have made, as I mentioned, you will each receive a personalized meeting schedule at registration. For the most part, we're trying to make sure you meet with your own state senator and your own state representative. Some of that's going to be a little in flux because some of them might not be in the building that day. If not, we'll pair you up with some other meetings, maybe from the area where your hospital is, where you work. But we want to make sure you have a good experience. You get a chance to meet with folks. You may meet with legislators. You may meet with their staff. I say this as a former staffer. Meeting with staff is not a downgrade. The staff is doing a lot of the policy work. They might even know the policy better than their own bosses do. So if you're meeting with staff, take the opportunity, to speak with them. Marianne and I both worked in the State House for years. I cannot overstate the value of getting staff on your side and having a good listening ear in staff. So not a downgrade if you're meeting with staff instead of legislators. We do know that there is a Senate caucus that day, meaning they kind of can't miss it. So some senators might be available and some won't. When you get there, I mentioned registration and check-in. In addition to your personalized schedule, you're going to get logistics, literally a map of the building. Where am I? Where is the coffee shop? Where are the exits to help you navigate? We're going to give you talking points for your meetings. I went over the legislation. You'll have like a 1 or 2 pager that has some talking points on the legislation. Again, though, the most important thing is your own experiences at the bedside with violence, with staffing, and with and access to care, and what's happening with that. You will get a schedule for the day, like what's, in addition to your own personalized schedule, that schedule at the beginning, what to expect, here's when lunch is out. You will get leave behind materials to leave with legislators. So when you go in, they say 5 of you go in together, one of you will leave something for them, because just like us, they're balancing a whole lot of things. We like to leave a leave behind, so they've got a summary of what you've talked to them about and they can refer back to it. You will also ahead of time receive talking points on priority legislation. So everything we just talked about, you're going to get some talking points on that, and a little guide that we drafted for you on how to lobby your legislators. Those will go out early next week once all the trainings have finished. So you'll have those, you can review them ahead of time. And I'll say this again later, but review, don't memorize. Again, the most important thing you're bringing is your experience and your personal views and tales from the bedside. You do not need to memorize public policy. You just need to know we need strong, enforceable workplace violence legislation. The details are my job and my team's job. All right, so meeting with your legislators, really, this is very basic. You want to introduce yourselves. My name is Megan. I work at St. Vincent Hospital because I grew up in Worcester. I'm on the PACU, and I've been a nurse there for 20 years. Let them know who you are. If you happen to know anyone in common, your kid plays soccer with a representative, good time to drop it. You voted for them. Don't feel shy about saying that. If you didn't vote for them, don't bring that up. But talk about connections you might have with them. My grandfather went to high school with you. I think you know my brother-in-law, Ted. Like, you guys coach, Little League together. Then we want to talk about what it's like on your floor unit. Give it color, paint a picture, like give them a feel, like what do they need to know as people who don't step into hospitals that often? What do they need to know about what's going on where you work? What are the challenges you face regarding staffing or violence or unit closures? Why are your colleagues leaving the bedside? What do you see as the most important things they need to know about what you see on a daily basis and what you and your colleagues talk about in the break room, on your text chats later, in terms of what's driving you away? As a tip, try not to use medical jargon or acronyms. I've listened to y'all talk sometimes and I get confused, and I've been doing this for over 10 years. Legislators are generalists. They're not going to know that stuff. So, central line, they probably they don't know what that is. A PACU, explain what a PACU is. They might not know what that is. Emergency department, they'll probably get that. PACU, explain to them what that is. Also, really important, this is not the time to discuss personal issues with the legislator. If you have a pothole on your street, this is not the time to talk about it. If you were not happy with the vote they took on education last session, this is not the time to talk about it. This is a time to make a connection with your legislator, and then you can follow up with them. If you be upset about the pothole on your street, be upset about something that's happening in your community, it's not the time to discuss it at these meetings. But let's say I meet Representative Smith and I say, I'd like to follow up with you on an issue. Get their email, or their phone number, follow up with them. Hi, this is Megan. I met you a couple weeks ago when we talked about staffing. I'm a nurse. I also wanted to talk to you about, and then go into the other issue because you've made the connection. So that's really important because we only have about 20 minutes in our legislative meetings. Legislators are like you and me. More than like 3 things or so, they're not going to remember them. It's going to be over their head. So we want to really narrow the focus of our meetings. So again, we want to talk to them about our policy asks are simple: pass workplace violence, pass safe patient handling mobility, strengthen the essential services laws, and oppose nurse licensure compact. Then, as you're leaving, a big thank you. Thank you for your time, and offer to be a resource to them going forward. As a former legislative staffer, I can't tell you how wonderful it is to have someone to call and go, they're saying this about nursing in your hospital. Is that correct? Or I'm hearing this. Is that correct? You want to be a resource to these folks. There's a lot of power in being a resource. So preparing for May 8th, besides coming to this webinar and reminding your colleagues and friends who haven't come yet to join one of the other ones, what else can you do to prepare for May 8th? Preparing. Driving, getting into Boston. Let's talk basics. The closest and I spelled closest wrong. That's awesome. Your closest garage, I'll fix that for the next one, is Boston Common Garage. It's right under Boston Common. You're right up the hill to Beacon Hill. Public transit. If you're taking the T, red line and green line, go to Park Street. That's the closest stop to the State House. Again, right up the hill. State House is right in front of you. You can't miss it. If you are planning to take a bus, an MNA bus, we have them leaving from Canton. We have one leaving from Region 1, one from Region 2, and one from Region 4. And there is a van of folks leaving from Cape Cod. If you plan to take one of the transportation options offered by the MNA, please make sure you have registered. When you signed up, you should have checked off if you needed transportation or not. If you're not sure if you did, please reach out. If you've changed your mind, either you do or don't need it, please reach out, because we don't want to leave anyone behind, either at a regional office or, God forbid, in Boston. So arrival. When you get to the State House, we are going to have MNA staff out in front directing you. There's, as I mentioned before, there's 2 main entrances. You are not going to be alone. They're going to direct you to places. There'll be more MNA staff there, more MNA staff in the building, directing you to where you need to go at the grand staircase. Preparing for security. As I mentioned, security could take 4 minutes or 40 minutes. We do not know how many folks are coming into the State House that day. A reminder, if you can, put everything in one bag: phones, belts, keys, pens, take your coat off, have it ready to go. Security is very friendly, but it can be a little slow. More preparing, do arrive on time. If you're taking a bus, please don't make us wait for you, because we won't be able to after a certain time. Registration starts at 10. The speaking program starts at 10:30. We're asking folks to be at the State House between 9:30 and 9:45. Wear scrubs. It may seem simple, but we want to drive home the point that you are the nurses and healthcare professionals who do the frontline care. You are not the suits in an office who have an RN after your name or a whole lot of letters, but don't actually do work with patients. Wear scrubs or M&A blue. Wear comfortable shoes. The State House has marble floors. Ow, after a while. So seriously, comfortable shoes. Think about what you wear at a shift at the hospital. Be ready to tell your story from the bedside. Ask questions of legislators. Ask questions of people in the building. Ask questions of us. Don't hesitate. Take pictures. It is a beautiful building. It's a really fun day, and I love seeing nurses in there. If you take pictures, send them to us. You'll get emails about this afterwards, but I'd love to have copies of the pictures. This entire presentation is full of actual pictures taken in the State House when we brought other nurses in. So we'd love to have that. What am I doing next? Be flexible. I don't think I have to tell healthcare providers, nurses, healthcare professionals the importance of flexibility. We are going to try our best to plan every moment of this day, but inevitably, something's probably going to go screwy. So we ask folks for their flexibility and a sense of humor, and we ask you to have fun. Enjoy this day. Don't be late. Don't bring weapons or sharp objects. I say this as someone who went through security with her son's Cub Scout knife in her purse last year. So just check, make sure you don't box cutters or things in there. Also, don't be intimidated. I have a lot of folks, it's a beautiful building. It's big. It's kind of regal. Again, you're the experts. Don't be intimidated. Those folks work for you. So I want to make sure that you kind of remember that. All right. The most important thing you can do is show up. Honestly, your vast numbers, all of you being there in that building, that energy is the most important thing you can contribute to May 8th. So thank you for doing that. Other things. You can think ahead of time about what your legislator might want to know. Think of a story you might want to tell, or an example, or talk to your colleagues. What do you think they should know? What should I tell them about? Review the talking points that you're going to get in an email next week. Again, review, don't memorize. This is not a test, okay? It's just kind of to familiarize you with things you might want to know. Read over the one-pager, How to Lobby Your Legislator. Again, that's coming out in email to you all next week. And you can look up who represents you on Beacon Hill at wheredoivote.mass.com. If you happen to know your own state representative, it's always good to see if you know their name. And that's it. Questions? So Marianne, I'm not sure the best way to do questions. If you want to call on folks, you see hands.
I have 2 hands that are raised. So
Great.
I feel like we have Susan. Susan, I think your hand just went down, but I don't know if she left, but I have Victoria. So if Susan's left, Victoria, if you'd like to ask your question. And Victoria, you're still on mute, so. And I think it's Victoria Salamane, and I could be screwing up that name, and I do apologize if I am, but I see one hand up.
I'm sorry, I didn't mean to raise my hand. I
Oh,
raised
no
it a
problem.
long time ago.
No
Sorry about
worries. Okay, I had seen Susan, I saw Susan's hand up, but then I don't see her hand up anymore. So um any other folks? Megan, you did a wonderful job. I think you covered everything. I think this is really, really comprehensive, and I think it's going to be a really an exciting event to have everybody back in the State House. So any questions that folks have?
No question is a silly question at all, please. Chantel?
Oh, Chantal, yeah.
When we go and see our representatives, are we gonna have someone from the M&A with us, or are we gonna be by ourselves?
That's a really good question. So first of all, you are never going to be by yourself. We are doing our best to have some M&A staff at all the meetings. I can't guarantee that. If not, you'll be sent with other M&A members. I am not sending anyone into something all alone. But we are
Okay,
doing
thank
our best
you.
to have M&A staff with you. The response has been overwhelming with how many folks we've got coming. So, like I said, we're trying to parse out our division. There are 7 of us in our division. We are all going to be working. We have a couple outside lobbyists we work with who will be accompanying people to some meetings too. But you will not be going alone. We'll be sending you with other nurses as well. But I'm doing my best to cover every meeting. I just don't want to guarantee it if the scheduling doesn't work out.
Okay, thank you.
You're welcome. Cindy?
Hi.
Tracy?
Yep.
Hi.
Hi. Which legislators would we be meeting with? The state senate, state representatives, or?
Yep. So we the people who represent you. So what we're trying to do is when you all signed up, the reason we asked for your address is so we could look up whose district you live in.
Mhm.
So right now I've got a big old spreadsheet that has every single person who's registered, their state senator and their state representative. And that's what we're using to base our meetings. We're gonna have to fudge a little bit if a legislator's not there. So for instance, you're in Brockton, you might be in Senator Mike Brady's district. So I'd have you go to a Mike Brady meeting. Let's say your state rep is not available that day. I might send you with some Brockton nurses who live in a different Brockton district to, or represent Brockton Hospital. But each of you will have a personalized schedule. Like I said, I'm trying to get folks in with their own state senator and state rep. I'm trying to get everyone at least 2 meetings. Some of you might be in 3, depending, because we have some areas where we have a lot of hospitals. But that's kind of how we're trying to do it. Does that answer your question?
Yes, thank you.
Okay.
I just like to do my research.
No, that's great. That's great. Thank you. I really appreciate that.
I think we have Zach that has a question.
Hello. So with these, the bills that the union is sponsoring, I know that they might be, people in the union itself might be familiar with them, but does the public know what we're advocating for?
So it depends. There's been a lot, honestly, in the papers around workplace violence and definitely on access issues this past year, like a lot. Those have gotten a lot of press. So yes, our bills have gotten mentions in the Globe, the Herald, the TNG, and a whole bunch of other things, especially on workplace violence and our essential services. I would say probably the one that's gotten the least press coverage is the safe patient handling legislation, because it's, it just hasn't been as flashy as the other ones. But yes, because we have an incredibly great communications department. And if you kind of even just look up like essential services, healthcare access, Massachusetts, you'll find us quoted and you'll usually see references to legislation.
Gotcha. Thank you.
Thank you.
Now thank you, Zach, for that question. Susan, I see one Susan.
Susan Wright Thomas, it looks like.
Susan
Yeah.
Wright Thomas is number 4, but Susan
I'm
number
sorry.
2. So it says, I don't have a last name for you, Susan, but.
I think that's me. Sorry, I didn't type my last name.
That's okay.
So I actually live in New Hampshire, so I don't have a representative, but I work at Tufts Medical Center.
Then we would send you with Tufts nurses probably to meetings around Tufts Medical Center. Or
Okay, that was my question.
another thing just off the top of my head, I'm not saying we're going to do this, but we happen to know that one of the legislators who is chair of one of the influential healthcare committees, his wife's a Tufts nurse. Very much might send you to that meeting.
Okay.
So that's kind of when I say I'm doing my best to get you places, like that's something I would consider for you. You live in New Hampshire, you don't have someone, but you work at Tufts with, at the same facility as the wife of a legislator who has a lot of say in healthcare. I might send you
Okay.
there.
Okay, perfect. I was
But
like,
thank
wait,
you.
as soon as you started talking, I was like, shoot, I didn't even realize that
Nope,
this was
nope, because you
for
have a
that.
stake in Massachusetts healthcare. It's where you practice and,
Yeah.
so, and you might even get healthcare across the border, so.
These are
Okay.
really great questions. So thank you, Susan, for asking them because these are questions that some other people have. So I have Susan Wright Thomas.
Yeah, I'm wondering if you think that legislators might bring up or want to talk about the Stewart situation and where we would go with that if they do.
So that's a really good question. It is very hard to control a 20-minute. That's what we're asking people to kind of go in with a policy agenda. The Stewart issue, and Mary Ann, please jump in if I'm saying something wrong here. Honestly, it relates back to the access thing. We're looking at 8 hospitals in Massachusetts. We've already got access issues.
Yeah.
We already need to be doing something to strengthen in Massachusetts the laws around what can close, what can't, what is needed in the public arena in terms of healthcare, like being preserved. The MNA strongly believes we need all 8 of those hospitals. And it's not just for the folks who work and receive care at those hospitals, but like I said before, for the folks who work and receive care at neighboring hospitals, because they're going to be inundated. So again, it's bringing it right back to the message around essential health services and preserving access, and that is part of it. Does that help? I mean, it's not a perfect answer, but
Yeah.
Yeah.
I think you nailed it. I think you nailed it, Megan. And I think
Yep.
a simple answer is we need all those hospitals to stay open, period, right? Like, just like you guys have always done advocating for your patients, but those hospitals need to stay open. End of story, because it has catastrophic effects on every other system and every other resident in the Commonwealth. But keep the hospital open, is a really good, simple message, but.
And that reminds me too, if you ever get a question from an elected official, I say this, some of you folks I recognize, you've testified at hearings for me before. I always tell you, if you get a question you can't answer, that's okay. You say, you know what, that's a great question. I'm going to have someone from the MNA get back to you with an answer on that. All right. And that's our job. Funnel that question back to us. Because again, you are not supposed to be an expert on everything.
I think we have another question from Zach. So Zach, you want to go ahead? And these are all great. So thanks for asking them.
Oh, no, I forgot to put my hand down. My bad. Sorry.
Oh, no worries. All right. So, and any other questions? Thank you, Megan. I'm not seeing any other hands up, but.
I want to thank everyone so much for taking the time to come. Thank you so much for signing up for this day. We want to make it a great experience. There will, as part of your packet, we'll have a feedback form because we want to do this more regularly. I want to give my division not a heart attack, but I want to make sure we're getting you all into the building and they're hearing from you directly. So any feedback after the day too, we welcome it because we want this to be a good experience for you and we want it to be effective. So thank you so much. And with that, go back, take your days back.
Thank you.
Thank you.
Great. Thank you so much. I appreciate it.
Thank you.
Good webinar. Thank you.
Thank you.
Excellent.
Thank you so much.
Thank you.
Thanks. Beth, I'll
Thank
see
you.
you tomorrow.